Was diagnosed with COVID on August 28th. It really didn't hit me until September 2nd, and then I ended up in the emergency room down here in Elizabethtown. So I was about 32 weeks pregnant whenever I realized I had COVID. My husband said, "Your mom's going to the ER. What do you want to do?" And so I said, "Well, if she's going, it's serious. I guess I need to go." The last thing I remember then is them saying, "We're calling your doctor. We have to take the baby."
After the baby was delivered, she was on the ventilator and was really struggling on the ventilator. It was obviously a little bit complicated because she was down in Hardin and she was sick enough that she couldn't travel. I ended up going down with one of our perfusionists and one of our CVICU nurses to Hardin, took an ambulance down there. The folks at Hardin Memorial were able to get me emergency privileges so that I could operate at the hospital there. We were able to bring her back up to Jewish and then bring her to the cardiovascular intensive care unit. And that's where she stayed kind of on that machine for almost a month.
The last thing I remember is, "Where's my baby?" But then I looked up at the wall and there was pictures of her, so I knew she had been born.
Eventually, she kept getting better and was able to get off the ventilator and kind of return to being herself again. I remember seeing her in the hospital on the day that she got to hold her baby for the first time, which was a pretty awesome day for everyone.
When I first started, I couldn't even walk from my bedroom to the living room without being out of breath.
We can help her build that strength back up. We know it takes time, but that persistence of pushing, and the best thing we can do is say, get stronger here, but use it all at home.
They push you to get better. If I hadn't have done that program, then I wouldn't have been able to be here today because I would still be on oxygen. I would still not be able to chase my children around. I wouldn't be back at work.